people are still not accessing the medicines they desperately need. And we campaign to change that.
Young people really can achieve change.
And we will achieve change.
I find it fascinating that inequality can lead to the outspread and sustained epidemics of HIV. We've known about HIV for over 30 years, and we have treatment that ensures that HIV does not develop into AIDS. And the treatment means that a person with HIV can live a normal life. It also means that the chance of transmission is reduced by 96% if they're on treatment. So with all these this incredible innovation and these incredible drugs, why does everyone who needs drugs not have it? Like 37% of people who have HIV don't have access to the treatment that they need. The problems with access come down to many different things. So sometimes people can't actually get to a clinic to get the treatment. Stigma will prevent people from actually saying that they've got HIV and then going to the clinic again. But also the treatments, some people don't really work very well with the first treatment that they get, which is quite cheap now. Actually, because generic companies have had the opportunity to make the drug as well and bring down the price. But a few of the problems around access are around the cost of drugs. So once you become resistant to the first line treatment of drugs, you then put on second line or third line, and third line antiretrovirals can cost up over $10,000 per patient per year, which is just too expensive for particularly developing countries or low income countries to afford for everyone who's infected. Pharmaceutical companies are profit driven, and there are very close negotiations that go on between pharmaceutical companies and the governments of these countries. So the price of all the different antiretrovirals varies country to country, and we don't know what goes in the negotiations, and that leads to another access barrier.
More and more issues of access to medicines affecting people at home too. People can't access life-saving drugs to breast cancer now. So kind of similarly, it's coming back to home and kind of reflecting the issues that people in the developing world face every day.
There's been more and more of a growing movement that has acknowledged that there's a problem with the way we research and develop medicines. And I think that's drawn more traction recently because it affects antibiotics, affects breast cancer drugs, which were recently ruled out of the NHS's Cancer Drug Fund, hepatitis C, which again is a global issue. So I think because it's starting to affect more countries, and particularly Western markets, it's receiving more attention.
We're not powerless, we all have a voice, we can all change things collectively.